Isabella Auchus, and my project aims to determine the prevalence and risk factors of sexually transmitted chlamydia trachomatis infection among women attending various health clinics and outreach sites across Fiji. Fiji is a part of the Western Pacific Island countries and territories, as shown here by the arrow. And this is a map of Viti Levu, Fiji's largest and most populated island, with 450,000 people. And this is where I did my study. Comprising the population of Viti Levu is a majority of Pacific Islanders, and of these Pacific Islanders, the majority are of Itake or Indo-Fijian ethnicity. Chlamydia trachomatis is a bacterium. It is the most common bacterial sexually transmitted infection worldwide, with more than 131 million cases annually. Fiji has been identified as having some of the highest concentrations of sexually transmitted infections in the Western Pacific region. At current rates in this country, untreated chlamydia can lead to devastating outcomes, including pelvic inflammatory disease, infertility, and adverse pregnancy outcomes. As healthcare is free in Fiji, the Ministry of Health provides various clinics and health outreach sites that provide health care and reproductive care to women. And these are located in both rural and urban environments. Literature indicates that people living in the urban capital, Suva, are less prone to poor health than those living in more rural areas. However, information about chlamydia in different areas across Fiji is largely unknown. This project introduced the approach of analyzing prevalence and risk factors of chlamydia across rural and urban clinics and outreach sites. And by addressing this gap in the knowledge, prevention and treatment services can better be directed towards those clinics who see women at highest risk for infection. This cross-sectional study consecutively enrolled sexually active women aged 18 to 40 at 18 different clinics and outreach sites. 6 of these were in rural locations, and 12 of these were in urban locations. After consenting patients, demographic and behavioral surveys were administered, a pelvic exam was performed, and a vaginal swab was obtained to test for chlamydia using a commercial nucleic acid amplification test. The key findings from this study were the overall high prevalence of chlamydia trachomatis and the identification of rural location, young age, and Itake ethnicity as potential risk indicators for chlamydia infection. We found an overall prevalence of 18% of people infected, and across all of the 18 clinics, there was a range of prevalence from 0 to 38%, with 10 clinics having a high prevalence of greater than 15%. Additionally, there was a significant difference in prevalence by location, with 28% in rural locations versus an 18% in urban locations. Finally, there was a significant difference in prevalence by age, with 26% of women aged 18 to 25 infected, and 15% of women aged 26 to 40 infected. Of note, no prior studies in the Pacific Islands had evaluated ethnicity as a potential risk indicator for chlamydia infection, and we found that participants of Itake ethnicity had the highest prevalence of chlamydia, the orange bar, and this difference was statistically significant. The study indicates that there is a very high prevalence of chlamydia infection among young women in Fiji. As there is a significant difference in prevalence by ethnicity, women of Itake ethnicity may be disproportionately affected by chlamydia trachomatis infection. Additionally, women attending rural clinics and women aged 25 and younger may be at higher risk for infection. Further analyses of these data will be conducted to better understand risk factors for women attending each of the clinics. And in conclusion, appropriate screening, treatment, and education are needed to better control this epidemic before it further compromises the health and fertility of Fiji's younger generation of women. And I would like to sincerely thank everyone who made this work possible and contributed to its success. I would like to thank my mentor, Dr. Dean, our funders, our American team in Fiji, and of course the Fijian team and doctors and nurses who I had the privilege of working with. Thank you.